hearty good afternoon and welcome to the session on importance of egg freezing. We are glad to have Dr. Ramya Mishra among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Today, we are going to discuss or speak about the importance of egg freezing. If you have any questions, any queries regarding this topic, you can put your questions in the chat box and we'll be happy to answer them. First of all, let's know what is egg freezing. See, we all know that when a female is born, we have specific number of eggs. And as we start aging, these egg starts gradually going down, and the egg number declines. So this egg declination starts from 30 years of age. When you age more than 30 to 35, when you reach 30 to 35, there is a further fall in the egg number. And from 35 onwards, there is a very steep fall. So when we say that the egg number is going down, the egg quality also declines at the same time. So this we call as ovarian aging and loss of eggs from the body. So when the egg reserve from your body starts falling, your potential or your capacity to get pregnant or to have a healthy pregnancy starts declining. So we all as females should understand this aspect of the biological clock ticking amongst us so that we can take appropriate actions at the right time and we can get healthy offsprings at the right time by taking the right steps. Before we go ahead, we I would like to tell you that बहुत सारी females ऐसे होते हैं which they come to us at later stages of life, approaching 40s, and they have not planned their pregnancies till now because of any XYZ reasons. For any XYZ reason, they were not able to get into a relationship or into a marriage, and they were not able to conceive, or there was any other problem, social issues with them. So when they approach us at a later part of their reproductive cycle, it becomes difficult for them to get a healthy pregnancy. So इसी aspect को देखते हुए we have tried to throw light on this topic so that and spread awareness amongst everyone, all the females, that all of them understand the importance of the aging process which is happening to us. Like अगर आपके डिसीजन आपने ये लिया हुआ है कि यस यू वांट टू परस्यू योर करियर, यू वांट टू गो अहेड, यू वांट टू डिले योर फैमिली प्लानिंग, सो हमको ये चीज समझना बहुत जरूरी है दैट वी शुड अंडरस्टैंड दिस एस्पेक्ट. सो दैट इज व्हाई वी आर हियर टुडे. सो एग फ्रीजिंग जो होती है इसमें इट इज यूजुअली डन विद in the process of IVF or in vitro fertilization, where don't do the fertilization as such. It is just that the female is assessed first. सबसे पहले assessment किया जाता है female का as far as their fertility potential is concerned. Ultrasounds are done, some basic blood tests are done, and then we start giving them some injections. These injections will increase the size of the eggs in their body, and after some time, like after 8 to 10 days, when the eggs are mature, they are given a special trigger shot, and then the eggs are taken out from the body by a very thin needle under anesthesia. So when these eggs are out from the body, some staging is done and the mature eggs are taken to freeze, and these eggs can be frozen for any number of years. आप इसको कितने साल भी फ्रीज करके रख सकते हैं. इफ यू वांट टू डिले योर प्रेगनेंसी फॉर नेक्स्ट 5 years or 6 years and you want to get, so you can have the eggs which were at that time, supposedly you got for egg freezing at 30 years of age, so आपके eggs का age उतना ही होगा and you can plan your pregnancy later on. जो आजकल जो एग फ्रीजिंग का प्रोसेस है इसमें बहुत सारे टाइप्स होते हैं. some of them we call it social egg freezing, where you want to delay your pregnancy, like I told earlier कि अगर आपको कुछ अपने कुछ स्टडीज करने हैं, अपना लाइफ पार्टनर आपको नहीं ठीक लग रहा है, अभी नहीं आप डिसाइड कर रहे हैं, या देयर आर सम अदर social strata also you want to achieve, you want to have your own house or you want to have more financially strong and you want to delay, so these kind of ladies or girls, they can opt for social egg freezing. So and there are other cases also where there is no social reason but there are some medical indications. Like if you have been diagnosed with some kind of cancers, breast cancer or some kind of ovarian cancer or some other problems, then in these cases you should plan for egg freezing process also. अगर आपको आपके डॉक्टर ने सजेस्ट किया है that you need to go for some chemotherapy or some other radiotherapy or some other procedure, then before undergoing these procedures you should go for your fertility preservation procedures, and wherein the importance of egg freezing is there, जहाँ पे आप अपने nearby IVF centers पे जा सकते हैं. You can meet your fertility doctors, you can take advice from them, you can before going for these chemotherapies or radiotherapies, you can preserve your eggs, you can keep them, and once you are done with with all the processes which are there, जो आपकी साइकिल्स होनी है या जो भी आपकी थेरेपीज होनी है वो सब करा करके, later on if you feel if you are okay, you can plan your pregnancy from those possible from those eggs only, and this gives you a chance of getting a baby of from your own genetic material. So it is important that you should be aware of these facilities which are available. You can also go for ovarian tissue cryopreservation in case आपके ovarian tissue को भी आजकल preserve किया जा सकता है. There also you can get a, if you don't want to go for IVF process or ovarian stimulation, so you can go for ovarian freezing also. If you have any queries, because this is a very sensitive topic, if you have any queries, we would be happy to see. Do we have any questions here? Yes, some of them have asked the questions. We have a question. We have a yes, yes. The question says, "What is the right age for egg freezing?" See, Sunita, like I told in the beginning, that the declination of eggs from the body starts from the age of 30 years only. So you have to go and approach your doctor, your fertility doctor, or your specialist, reproductive medicine specialist, and ask them when do I need to go for it. Yes, at the age of 35 plus, I definitely advise to want to go for egg preservation. But if you foresee that no, I am not planning to get to get married or not planning to get a pregnancy till the age of 38 or 40, then you can obviously plan it earlier at the age 30s also, you can go for it. So there is no as such, no limit is there, but yes, the earlier it is done, the better results we get from it. So that is there. I hope that answers your question. We have another question. Is egg freezing safe? Yes, Niti, it is very important to understand now that some time back the oocyte preservation, that we call it cryopreservation, was not a very effective technique, was not very effective. Like अगर आपने 10 eggs freeze किए हैं, so there were lesser chances to get, when the retrieval was there, it was less. But now we see up to 90 to 95% egg retrieval rates are also there if it is done with the correct protocols. So I would say that yes, it is a very safe technique to freeze your eggs. And as we all know that the injections which are given in the process of IVF are only for short duration, their effects is only for a short duration. So as soon as the injection effect goes off, the everything comes back to normal. So it should not be a point of concern, because after it's been almost almost 40 years since we have got this technique now, the IVF process into it. So I would say it is a definitely safe procedure. What is the shelf life? Shelf life, basically, I would say once it has been, the eggs are frozen at minus 196 degrees centigrades. So that is the shelf. You can say if it is preserved with the correct technique, with the correct in the correct place, this yes, for any number of years you can keep your eggs frozen. It may be for 10 years, 20 years, because abhi we just got to know about a news of embryo which was frozen for 25 years in US, and that has given a positive pregnancy and the baby has born. So the shelf life is for any number of years. But yes, once you're freezing your eggs at the age of 30, you can utilize them by 40-45 years. The renewal process is there. There are some legal things into that, so that you can go through, and you can go ahead with that. We have one more viewer is asking, for what duration eggs can be frozen. I think I just answered the question before, shelf life and duration of eggs. So you can start from anywhere, like supposingly you are doing it for medical indications, so it can start anywhere from 10 years. 10 years also. So that completely depends as per law how many years you can go for it. My 25 years old sister has been diagnosed with breast cancer to undergo chemotherapy. What will you advise? See, Mr. Singh, I just told in the session also that if somebody has been diagnosed as a case of cancer in any part of the body, especially your ovarian cancer or your breast cancer, then these patients should be asked to meet their fertility specialists so that they can guide them. It's always better to freeze your eggs before you plan your any kind of chemotherapy, because chemotherapy or radiotherapy, they have got adverse effects on the genetic material, genetic cells in the body. So it becomes difficult for them to conceive from their own eggs once they have been subjected to these kind of radiations or these kind of chemotherapeutic agents. So I would advise that yes, you should. Your sister is 25 years old. I'm probably she is not married, so she should definitely get for freezing of her eggs so that she can utilize them later in her life. Those things. I think what is the right? I think we have answered. Do we have any more questions here? I hope that answers well. That answers all the questions. Yes, there is one more question. Is 36-year-old unmarried women eggs can be frozen? Yes, yes. See, anyone can get marriage, has nothing to do with that. So anyone who wishes to get married later or plan pregnancy later, for any reason XYZ, can approach the fertility centers, and they can always ask for egg freezing. And nowadays the awareness has definitely increased. I am seeing cases like that coming to us and asking for egg preservations, but unfortunately the awareness has come a bit late. Many of them come at 40, 42. So that is quite a late time, I would say. So it is always, if you have anyone near you or your friends or your anyone who wishes, who you see that they are delaying their marriages or they are delaying their family planning, then you should definitely suggest them that this is a good option available to them, and they can avail it and have their own natural offsprings later in life. I don't think we have any more questions here. So, if you want to listen about some other topic also, please do let us know. You can put in the chat box, and we will be happy to come up with those topics also in the near future. Thank you so much for the patient listening. It was nice being with all of you. Thank you.